Hello, my name is Shanna Bigler, and I'm the Mental Health Education Program Consultant for the Kansas State Department of Education. The implementation of school mental health teams and creation of mindful crisis plans are more vital than ever as students return to school through the COVID pandemic. Crisis in schools can happen anytime and at any school. Crisis is typically preceded by some sort of change, a change in an individual or child's mood, behavior, dress, demeanor, etc. We know that crisis prevention is always best practice, and this may include student and staff training on crisis topics such as school safety, bullying, and suicide. Even with all of the preventative measures taken to the best of a school's ability, there is still a chance of a crisis. Being prepared to respond to crisis rather than react enables more organized and effective actions. The implementation of school mental health teams and thoughtful school crisis plans are two ways schools can ensure that they're most equipped to respond effectively to crisis situations. Students are experiencing unprecedented effects on their emotional and mental wellness as the impact of COVID compounds upon the typical challenges of youth navigating their social, emotional, and mental development. Emerging data from the COVID pandemic suggests an increase in children experiencing stress, in child anxiety, an increase in child depression. Initial reports are even showing greater number of teens experiencing challenges with eating disorders. There's been an increase in emergency room visits for suspected suicide attempts. In fact, teenage girls showed a 50% increase in ER visits in early 2021 as compared to the same period in 2019. Anecdotal teacher and social worker reports indicate an increase in significant student behaviors in Kansas. Effects of isolation and loss impact our kids. This need is evident and is not going away in the near future. Children and teens' brains are not fully developed until well after high school. Therefore, these issues can become overwhelming and result in very large and challenging and hard to manage feelings. If not helped, these feelings may lead to a school crisis. Effective school mental health teams do not have to be complicated. It can be simple and broke down into very basic roles. There's often a coordinator, assistant coordinator, and qualified mental health professional. Oftentimes, a coordinator is a principal, with the assistant coordinator being the assistant principal, an instructional coach, a building leader of some kind, and the qualified mental health professional being a school social worker, counselor, or school psychologist. In the coordinator role, the coordinator would coordinate annual trainings for the team, the school faculty, and staff members. They would mobilize team members as needed, coordinate team member assignments, coordinate prevention, education, and resources to school staff members, students, and families, and act as the liaison between the school, family members, and the community members. The assistant coordinator is there to do all of those roles when the coordinator is unavailable. Further, they coordinate communication among staff members, students, families, and community members. They share updates with the school mental health team and facilitate communication with caregivers and guardians when concerns arise. Qualified mental health professional works to conduct student interviews, assess risk levels for suicide, provide safe and comfortable environments when working with students and families, connect students and families to community resources when appropriate, and documents actions. Beyond the school mental health team, all staff should know their roles in a crisis. These roles might include being part of a communication chain, maintaining safety, ensuring security of the school, monitoring an individual's personal safety, or conducting a safety screening. Communication is imperative in a crisis. Knowing who communication should go between and how that communication will take place will avoid mixed messages and maintain the confidentiality of information. Further, a solid communication plan will relieve the sense of panic as when communication is clear, people are better able to think and respond, and they're less likely to be functioning solely out of the emotional state of their brain. A crisis plan should be active and fluid. It should always be considered in revision based upon experiences and new knowledge. All staff should be trained on the plan, and framework of it should be built into the school norms. It is important to consider all staff in a building and clearly include what is expected of them. For example, if a building goes into a secure campus status, what should staff that may travel between buildings do? Finally, identifying what reporting and documentation will be needed is important. Anytime there is a school crisis, district-level leadership must be informed, as they also have a role in supporting the school dealing with the media, creating messaging, and informing the school board. The documentation will always be needed in writing, so consider creating crisis forms that are comprehensive and asking for information so as to avoid someone forgetting something important following the crisis. This school year, we have seen a significant need for schools to have a specific suicide crisis plan. The Suicide Prevention, Response, and Postvention Toolkit can be found on the KSDE website under Suicide Prevention Training or in the search bar for Suicide Toolkit. This tool can be vital for schools in creating their suicide plans. The Suicide Toolkit covers prevention, response, and postvention aspects of school suicide. There are many useful tools, such as this flowchart, as well as checklists and screeners that can walk mental health teams through the steps of creating their own suicide crisis plan. KSDE strongly encourages the use of this guide. As we work to support students in all areas of their learning and wellness, it is important to collaborate with community entities that can aid in this endeavor. Children are 6 times more likely to get evidence-based mental health care when it's offered in schools than they are in other community settings. This quote came out of an article in the January edition of the State Legislators magazine. This article was advocating for bolstering the capacity of schools to support children and mitigate some of the challenges for mental health and behavioral health resulting from the COVID-19 pandemic. The Trauma Responsive School Community e-learning modules and facilitation guide is part of the School Mental Health Initiative and literally walks a district through what it means to be trauma responsive and create a school-community partnership that works as a team in a unified approach towards streamlining services to kids. Many districts in the state have benefited from this organized system, and this module provides all districts with the information to create such an effective collaboration system within their community. These are the resources used in this presentation. If you have any further questions on school mental health teams or crisis plans or any other mental health related issues, please feel free to contact me. My email address is sbigler@ksde.org. Take care.